Commissioner of Health for the City of Milwaukee Health Department. We're here today at Keenan Health Center, which is one of the most busy health centers we have in the health department. We offer a lot of different services here. Obviously, folks are here to hear about the STI clinic, but we also do WIC, tuberculosis control, immunizations, and community health access, which is essentially health insurance enrollment services here. During this closure of our STI clinic, which we're standing in right now, those services will not be affected. So patients and residents who still need those services can come following the schedules that we have for the clinic. It is only the STI clinic that today will be closed indefinitely. I'm sure a lot of us are wondering why we got to this point. For the last couple of years, we've actually been having challenges staffing our public health nurses in particular. These positions are critical to the roles of patient care that we provide here, and have tried a lot of different solutions to solve our staffing issues. So we've used temp staff, we've reduced our hours, we've also reduced our services that we offer, and even during those reductions and pullbacks on staffing, we still had over 9,000 patient visits last year, which is quite a few. And we're very proud of our team that has stuck through this difficult time. We have over 95% of our patients that we see have successful treatment and diagnosis of their STIs that they have. But this was a difficult decision to make, given that this is a critical resource that we provide here in the community. Those different approaches that we tried to fill the vacancies have not been successful, and unfortunately, over the last couple of weeks, we've had a couple resignations and reduction in available hours for staff that are here. That really led us to this moment where we've made the difficult decision to close the clinic. This was not an easy decision to make, but we also felt that this was the best way to innovate and try to improve the services that so many people rely on here in our community. So this closure, as we've mentioned in our press release, will be for a couple weeks. We anticipate having an updated timeline in Thanksgiving, the Thanksgiving week, as to when we're going to be reopening. But one of the biggest challenges, we have to understand when our new hires are going to be able to start, have to get them trained up to speed. So that is the unknown factor. So we're just asking for everyone's patience during this transition. On our website as well, we have all of our community partners and federally qualified health center clinics that we'll be providing same-day services like we do here at Keenan Health Center during this transition. So there's a lot of different supports that we're offering, and with that, I just wanted to say thank you to the Mayor's Office and our Department of Employee Relations. This has been a really challenging time for all of these issues to kind of cascade all into this moment. And Deputy Commissioner Jefflin Brown is going to speak to a little bit about some of the next steps we're going to take to ensure that we meet the staffing needs for this clinic. Jefflin?
Hello, I'm Jefflin Brown, Deputy Commissioner of Clinical Services, and as Dr. Todoritis stated, we have been struggling to ensure we have public health nurses on staff here, and so we're thinking outside the box. We are going to be hosting 3 open interview hiring events. The first one will be November 18th from 9 a.m. to 6 p.m. The second one will be Friday, November 21st from 9 a.m. to 4 p.m. And then the third one is December 1st from 9 a.m. to 6 p.m. We figured that it's important for nurses to come into our building, see the workspace, and we can actually talk to the staff that do the work. Part of the nursing shortage is across our city, but the nurses play a critical role. Nurses are the most trusted profession, and we make sure that our clients are seen, they have the care that they need. We collaborate with other disciplines under the Sexual and Reproductive Health program to make sure everyone's needs are met. This clinical is critical to our community. As the Commissioner said, this decision was not easy to make. We provide free services here, and we know that our community looks for that, and so we are working as quickly as we can to ensure that folks are able to apply and kind of reduce some of the barriers. We have also posted a link for individuals to apply on Instagram, Facebook, and also LinkedIn. So on the City of Milwaukee Health Department page, those links are there. If for some reason someone cannot make any of those events, they are to email our human resources team at mhdrecruitment@milwaukee.gov. We want to make sure we're reducing barriers, and if somebody needs to interview at 7 a.m. or 12 p.m. on a Saturday, we are game for it. This is how important this is to us. Thank you.
We're happy to take a couple questions.
How many people do you normally work in this clinic, and then what are you working with at this moment?
So it's a combination of both nursing positions as well as support staff. So we have a couple offers pending for public health nurses right now. So we have 3 offers pending. We have 1 critical vacancy right now in the nursing staff, and then we have 2 public health nurses in our neighborhood nursing team that would be backup to our nursing staff here. We have a medical assistant vacancy, and recently we just, because of a promotion, one of our lab techs is not, that position is vacant as well. So in total, it's about 5 vacancies at this moment with 3 offers pending. So those, assuming that those translate to full-time hires, we will be in a little bit better shape. And again, that's where we want to reassess in a couple weeks. However, if any of those offers pull out of the selection process, then that would raise the number of vacancies from 5 to 6 or 7.
So over the last year, you guys have been trying to fill up those 5 vacancies, or is this just the number overall?
Yeah, so unfortunately, I think going back several years, this has been an issue where we've been limping along with using the mix of temp staff and reduction of hours. And what we've experienced is that a lot of the staff that have stuck through end up getting burnt out pretty quickly. And we have high client volumes, and some days we could see 40 to 50 clients a day. And on days where we've had shortages in the last couple of weeks, there's only been 1 nurse on staff in some days. So that is not sustainable. And we care deeply about not only the clients that we serve, but also our staffing here at the department. So that's, again, part of that reason why we made the decision to close.
Are there any long-term, solutions for staff members, maybe so you can try to avoid another closure in the future?
Yeah, you want to talk about that?
Sure. So with public health nursing, as of now, you need a bachelor's degree to practice as a public health nurse. There is an opportunity for us to change our credentialing to offer some associate degree nurses to work under a bachelor's prepared nurse. We believe that that creates a pipeline to the nursing profession, specifically public health nursing. Aside from that, as Dr. Todoritis said, our clinic here is very, very busy, and so we're even looking at, okay, do we schedule a lunch break for everybody at the same time, similar to what pharmacies in our area do, and really looking at things that we know we need to improve on. Reaching out to schools of nursing and just other areas just to make sure we can recruit more nurses. Our hope is that by bringing on associate degree nurses, really looking at the folks we bring in, getting feedback from them, getting feedback from leaders, that hopefully we won't be in this situation again. Another component to that, as Dr. Todoritis said, we have a neighborhood nursing program. Those staff will be cross-trained to work in this clinic so that hopefully, again, we won't be here again.
So how many staff in total do you usually have? Because I know you said you're missing 5 positions right now, but on a regular day like today, how many people are supposed to be in this building?
So when you say in the building, we have other programs in the building.
But
So specific to sexual and reproductive health, roughly about 20. So there is the STI clinic portion of the program, and then we have disease intervention specialists, and that's the other side of this program. So those folks reach out to clients, find out about their partners, and offer that education and outreach piece while the nurses are here treating and screening and doing those type of clinical skills for the clients.
And how many do you guys have right now? Yeah, how many public health nurses?
We should have,
fully staffed?
sure, so we should have 5 full-time public health nurses. We also have a nurse practitioner, and we also have a public health nurse supervisor.
So is it safe to say this is a nursing shortage or just a staffing shortage?
It is a nursing shortage, which is why we're looking at the other avenues.
I'm so sorry.
That's okay.
The question came up to me. So right now, is it safe to say that you guys have 15 people, since you guys need 20 to be fully staffed, and you guys need 5? Or how many?
So in the side of the STI clinic, we should have 5 full-time nurses, a supervisor, a nurse practitioner, That's 7. We should have 2 medical assistants. Right now, we have 1, so that's 9. And then we have an office assistant, which is 10. So it would take 10 folks to fully run this clinic every day.
Ideally, for the timeline, when would you guys like to be fully staffed?
Well, we're hoping, we have these open recruitment events. Hopefully we get a good turnout. That's what we're hoping for. We would love to open as soon as possible. Again, we'll reassess the week of Thanksgiving, but if those events turn out really well, it could be sooner. And then we obviously have to train them as well, potentially.
With this closure, what happens to the nurses who are currently on staff?
So the nurses who are currently on staff, we're looking at our workflows. We're looking at how do we improve things. We're looking at a variety of different things just to make sure that we're providing the quality of care that is needed so that when new nurses come, we have some things in place. We're also looking at our training and what does onboarding look like. So our staff that are here are still very busy behind the scenes.
Can you explain, you said that you have 5 who are on staff at the clinic, 3 vacancies. Why was the decision made that you couldn't proceed with just the 2 at some kind of reduced hours, even more?
I can take that. Yeah, so I think one of the challenges that we have is that staff still have vacations and PTO, or someone calls in sick, and we only have a couple staff normally here in the clinic. Even when we reduce the hours, we reduce the services, we still have a high demand of patients coming through. So in the last couple of weeks, we've stopped seeing clients by noon that day because we have a queue of individuals who are seeking treatment for us. So we recognize that part of that burnout is not being able to take a lunch in some cases. So we always encourage our staff and mandate it that they do, but our staff are really committed to providing patient care and sometimes don't take the lunch as they're working through. So as Deputy Commissioner Brown mentioned, we're really looking at how we're going to schedule not only our current workflows, but then look towards the future to ensure we don't have that burnout.
Has the clinic been cited with any code violations this year?
No.
Okay.
How many patients do you guys serve on a day? You said this is one of the busiest healthcare centers you guys have. So how many patients do you serve maybe daily or a week? I just want to know how many people this is impacting.
Yeah.
Yeah, so right now with our reduced hours that we've had for the last couple of months, it's about 30 people a day. And sometimes those 30 people, there's only 2 nurses kind of caring for them.
And what should patients do if they can't come here?
So if patients, if they happen to show up here, we do have a list of resources down on the first floor that our staff will give to them. They can also go to our websites where we have some community partners who have let us know that they can accept patients the same day. And so we have the hours listed there, we have the phone number, address. If a patient just doesn't know what to do, give us a call. We will help navigate that with them.
Have patients been notified about this too, or any notice sent out to them too, or will they be receiving something in case they don't see this?
Yes, so we have updated our socials. Sometimes patients do show up here, and our team has done a really good job of just explaining while we're closed and just saying, do you have somewhere to go? Do you have a way to get there? What's close to your home? So we are helping patients on an individual basis, making sure we're meeting their needs.
And for folks watching this, that are maybe interested in hiring, what kind of benefits or what is being offered for them? Is there, competitive compensation or any information that you would like to?
Yes, thank you for bringing that up. The city, I'll be honest, I'm kind of biased. It's a great place to work. I enjoy being here. I enjoy working with the community. So if there's someone passionate about working for the community, please come. Please come to the hiring events. Please reach out to us. As far as benefits, we offer a very good benefit package. We also have a pension. We have professional development. We have a public service loan forgiveness. So there are a lot of benefits to being here and working for the city. And also at those hiring events, our Human Resources Department for the Health Department will be there, as well as our Department of Employee Relations for the city if folks have specific questions.
I think you mentioned that some services in the clinic will still be offered. What are those services?
Yes, so in this building, there is our tuberculosis care and prevention program. We also have an immunization program here, 1 day a week. We also have our lab who's here. We get samples that are dropped off, and we also have WIC that's here on the first floor. So women, infant, and children, that program is still running, and folks should show up if they are supposed to be here. That is,
Two more questions.
Is there a plan for just in case, staffing doesn't work out in the time frame that you guys have right now? Just in case it goes on, prolongs just a little bit longer?
I think we're trying to be very optimistic and think outside the box. What we're doing now, I don't think we've done before. And I think also, as someone who's connected with some associate degree nurses, there is a need there. There is a desire to work in public health, but there's a barrier. So that's why we're looking at trying to remove that barrier and try to get a pipeline to the workforce.
Last week, the clinic was closed, I saw on Facebook. Was it also closed all of this week? How long has the closure been for?
Yes, so the closure started this week. We did have to close unexpectedly some days last week, and that contributed to, some staff being out, being sick. Again, our staff have been burned out, and I really encourage them to take care of themselves. So that led to some of those closures last week.
Thank you, everybody.
Thank you.
Thank you.
Does everybody have Jefflin's name spelling? It's Jefflyn. Jefflyn Brown, Deputy Commissioner of Clinical Services at the Health Department, Jefflyn Brown. Jefflyn.